Good day, everyone. My name is Mariya Malova, and I'm a neonatologist and researcher at Gaslini Hospital in Genoa, Italy. Today, I would like to tell you something about work that we have conducted in our neonatal intensive care unit that speaks about premature children. So, what is known, or what is already known, is that when a woman is at risk of preterm birth, if you give her a special drug, and cortisone, normally befamahizone, you can help with the lung maturation of her future baby. Why is it important that the lung of a preterm baby is mature? Is that respiratory distress syndrome, so problems with the lung caused by its immaturity, is one of the major causes of the problems that a premature baby would face once out of the womb. So it is really important that we can somehow help the lungs of these children to get ready to their own life outside of the womb. And as this is already known, this is something that scientists have already found out. Nowadays, all women that are at risk of preterm birth and have a special at certain gestational ages would receive these 2 shots of befamahizone in order to help the future babies. But what is not known is what will happen if the mother gets her shot and then there is no preterm birth, or at least not the preterm birth doesn't happen right away, and the time passes, and then the baby is born. Will the drug still be effective, or will it not? Will it? So if the drug is not effective, then we have to give maybe dose, another shot to their mother, the future mother. Another thing that is not known is what will happen with the brain of this baby. Because sometimes the drugs, as corticosteroid drugs, can have negative influence on the brain. So that's why we decided to conduct our study. We have analyzed retrospectively, so we have looked to the clinical records of the babies that were born for 3 years in our department, and we have looked at what effect would this prophylaxis make, because sometimes not all it is advised that the women receive this therapy, but not all of the women can actually, because it depends on how fast is their preterm birth. So we have compared the group of the kids born from the mothers that have received this antenatal corticosteroid treatment and the group of the women that have not. And we have also seen what was the effect of the timing. So more time has passed between the shot and the birth. And we have also looked at the effect on the brain. So what have we found out? First of all, we have confirmed that actually it is useful to do the treatment, because the preterm babies whose mothers have received the shot were doing better with their breathing problem. They had less breathing problems. Another thing that we have seen, that actually they have been now lost in effectiveness of this therapy with time. So even if there was 21 days and 3 weeks have passed between the shot and the birth, it was still effective. We have also seen that this drug, this therapy, was effective also on preventing some brain lesions. So the children that were born from the mothers that have received this therapy had less intraventricular hemorrhage, so less hemorrhagic lesions in the brain, and also less white matter damage. So their brains were more healthy. And the last thing that we have seen is actually that there was no negative effect on the brain of this treatment. So the dimensions of the brain, the size of the brain growth was the same between the groups of the infants that whose mothers have received corticosteroids and the ones who have not. And also the maturation of the brain was the same. The only thing that we have noted that was connected with time was that if more than 1 week have passed from the prophylaxis until birth, then their most preterm infants, the ones that had less than 28 weeks of gestational age when they were born, had less protection against intraventricular hemorrhage. So to protect the brain in the best way, it could be useful to try to do the prophylaxis as close to birth as possible. Of course, our data are only preliminary data. They were based on the lookup of the records, so what is called a retrospective study. So more studies are needed in order to confirm our findings. But it was still useful to look at that and to give our colleagues a direction in which they should look for new answers in order to protect the premature lung and brain. Thank you for your attention.